Joining me, this is Dr. Erica, again, pharmacist. I am going to be brief on this particular content. I am the owner and founder of Millennium Pharmacy, pharmacist for close to 10 years now, registered, and I received my degree from Auburn University of Auburn, Alabama. I'm going to talk about a few of the weight loss medications that are available over the counter and prescription wise. And I want you to actually look into this, especially if you are overweight or morbidly obese, or just want to maintain a healthy lifestyle and help decrease chances of those silent diseases such as diabetes, hypercholesterol, uh, cardiovascular events such as stroke and heart attack, coronary artery um, clogging as well. We want to prevent those, and we can prevent those with these medications I'm going to talk about. So the medication is called orlistat, and it's available over the counter as Alli or Alli, ALLI. And then it's available in the prescription form as well in the pharmacy department only. So do take note. It's called Xenocol when it's through the pharmacy, and it's called Alli when it's over the counter. And it's been approved for quite a while, and it's still on the market over the counter. And so I want to recommend it. So stay tuned to the end of the video, like, share, and also hit that small button right there, subscribe button, and stay tuned to all the video contents that I have and I want to share with you. And so let's just jump into it. So orlistat works by repelling fat from being absorbed through the stomach lining and intestine lining. So what it's going to do is going to repel fat, and that fat is going to be discarded through the intestines and ultimately through the rectum. Now, once that prescription starts to work, you may see a oily stool. You may see a greasy stool. So a lot of the grease that you eat in fatty meals will come through the intestines and not be absorbed. So that's how you're going to lose weight. Also, I want you to know that it's not indicated for patients who have a stomach lining disorder or malfunctioning, and it's also not indicated for those who have an allergy. Now, the medication itself is tablet form or capsule form. And then I want to say that it's also not recommended in patients who are taking cyclosporin. So do be aware of that. And you have to be at least 18 years old to actually purchase the product. So again, you have to be at least 18 years old to purchase the product in the USA. Um, it comes in a 60 milligram capsule. And I want to say that it was approved back maybe in 2007. It was approved by the FDA, and it's again, it sits on you can just pick it up as long as you're over the age of 18 or you're 18 years old. You can just pick it up without a prescription, and then you can purchase that product. Also, you want to separate it from your other medications at least by 2 hours, especially your vitamins, your supplements. You want to separate it by 2 hours. And then also, um, if you're not eating a fatty meal that day, then you can skip that medication dose. I was surprised to see that. Again, if you're not eating a fatty meal, go ahead and skip that day's dose because you're not eating a fatty meal, so there's no fat to extract through the intestine area. Okay, so that's how orlistat is going to work. Again, it's going to repel fat content, allowing the body to rid itself of the oils and the such as the trans fats, all of those different fats, saturated fat, non unsaturated fats that we don't need. Those things are going to be coming through the intestines. Okay, so that's what I wanted to mention. And it's a good way to keep cholesterol down too. So that is also going to contribute to weight loss. Okay, so do take notes and check with your pharmacist to find out, if they have any in stock. And also, you can get a prescription. But first, your doctor is one to go on is one to make sure that you are actually qualified, because the prescription strength is going and it's prescribed through the FDA is going to require you to qualify for it. Okay, and that qualification um, method is going to be that you have been for 6 months on a solid, healthy diet consistently, and you have been doing your cardio, aerobic, moderate intense workouts and exercises to reduce your weight. And you want to make sure not only are you eating healthy and exercising, but they're going to make sure that you are actually coming down on your weight before you qualify for the orlistat Xenocol, which is the prescription form. So if you want to bypass the doctor's approval for you to take the medication, you can purchase it again over the counter on the shelf at 60 milligram capsule. You can purchase it then, okay, as Alli. And and just be on the safe side. Just monitor your weight. Make sure you're not excessively going underweight. And I would monitor to make sure that you're at a good body mass index or BMI, just certain that makes certain that you're not abusing the medication or misusing the medication, I should say. And you don't want to lose so much weight that you become anorexic or obsessive with this prescription, because it can be psychologically um, a dependent on your body. So don't don't get too attached to these particular medications. Do use them with caution. I will say that, do use them with caution, because as a pharmacist, I've seen as a pharmacist for close to a decade now, and as a pharmacy intern for 3 years before that, I was seeing a lot of medications for weight loss being misused and miscalculated and so forth. So I want to just put that out there, okay? Also, some of the side effects. I'll go over some of the side effects because it's going to be a lot of fat content exiting the body and so forth. The GI tract may feel uncomfortable with bloating and also frequent stools. Okay, frequent stools, of course, because the body is trying to compensate by releasing fatty foods can help decrease the adverse effects. I'll say that again. Decreasing the amount of fatty foods that you intake can also decrease the amount of medication side effects. So do take note of that. It's 1 plus 1, ABC, easy. Okay, you can do the math. If you're not eating a fatty meal, don't take the pill that day. Okay, wait and take it on another day where you're actually out and eating a fatty meal. Okay, so do remember that. And the body mass index is something that you want to go by. You want to keep a body mass index chart with you. You can find the chart. You can Google and find a chart to let you know. And then the calculation for BMI, you can calculate yourself, or if needed, you can, which I suggest, you ask a pharmacist to sit with you and talk with you and do a screening, an official screening, and they can go over your BMI, they can go over your cholesterol, your blood pressure, your weight, and they can tell you all about yourself as far as your objective information. So that's what I want to recommend, okay? Talk with the pharmacist, sit down with them to calculate your BMI. Also, your doctor can do that for you in the doctor's office as well. So do be mindful. And so that's all that I had for orlistat and body mass index, weight loss. There's also a Phentermine or Fen. You've heard of that in the media. Fen is another one that is prescription only, and it works. That'll be another video, but just briefly, Fen or Phentermine, also known as ADIPEX. ADIPEX works in the brain. Okay, what it's going to do is tell the body, okay, I'm full. I have a full stomach right here. The brain is telling itself, I have a full stomach. I don't need to eat anymore. So that's how Phentermine works, or Adipex. It works here. It doesn't work in the gut like the orlistat does. So it's a different mechanism, and you have to qualify officially for that. It's not over the counter where you can just purchase it, whether you're 18 or over. But you have to actually go to a doctor. They'll have to screen you officially and monitor you and make sure you qualify to receive the prescription. And again, the qualifications or 6 months of intense, moderate exercise, and then 6 months of a healthy, nutritious meal, vegetables, fruits, fiber, your protein, your water as well, water consumption and water consumption, of course, is going to be. I'm going to let you know in this video. It's going to be 8 ounces of water. I'll repeat, 8 ounces of water, or 10 to 30% of your body content. So do be aware of that. And also, I would recommend that you keep your salt intake to a minimum. Sodium intake should be at a small medium, just because you don't want water retention. You don't want um, problems on your heart, where water can be sitting around the heart, or sitting around the kidneys, or sitting around the extremities of the body, in the calves and the feet and ankles. So minimize your salt intake, because that helps to contribute to your actual body weight as well. If you have a lot of edema, is what it's called in the medical field, then more exercising, do more exercising so your body can circulate that your circulate and help to reduce your fat content around your waist circumference as well. So your waist circumference is very important. It's similar to your BMI. It's also a measurement. And for women, that should be 30 inches. And for men, it should be 40 inches. Again, waist circumference, 30 inches in women, 40 inches in men. And that is just a general uh, one, one, one way measurement. Okay. You don't have to do any calculations for that. And so the weight circumference is going to help determine a patient's lifespan and also their quality of life. And also, it helps to determine how healthy a person is. So the bigger the waist of the circumference, and then of course, the heavier the torso is going to feel, the heavier the weight on the body, the more insulin has to be put out by the pancreas, and also the more the heart has to work. Okay, the heart has to work overtime or work over in order to compensate for that extra weight that's um, not recommended. So that's what I want to put out today, and I thank you for joining me. I know I've gone over my time for this video. I only wanted to do a few minutes just on orlistat, but you can't, when it comes to true health, okay, you can't put one off and not uh, consider all aspects of the medication, all aspects of how it works. And so I just wanted to get that information out there. Please binge watch on all my videos. I'm uploading new videos, new content, new features, and just trying to get more subscribers to this channel. Also, hit that subscribe button right there that you see. Also, share with family members, share playlists. I have a playlist, a plethora of playlists that are good information from a healthcare provider. Also, if you don't subscribe to this channel, at least have a health coach that you can find on YouTube to actually go through their videos, okay, and learn more about how you can be more proficient and more healthy. We all have different, areas in our health that we can work on. So do be mindful of that. I'm signing off. I'm Dr. Erica. Take care.